5 causes of erectile dysfunction, and the one thing you can do to help with all 5 of them. All 5 issues are related to a hormone, but not the one you think. Hi, I'm Dr. Midge, a physician on a mission to share the health. Before I get into the list, let's talk about the scope of the problem. It's difficult to ascertain the true prevalence, as many men do not seek medical attention. Best available data predict about 52% of men in the U.S. between 40 to 70 years of age suffer from erectile dysfunction. There are at least 150 million men globally with this problem, but this is a gross underestimation. So if you are struggling with erectile dysfunction, you are not alone. Let's get into the list. Number 1, neurological disorders. In order to achieve and maintain an erection, your nerves must work properly. Neurological conditions such as multiple sclerosis, Parkinson's disease, and Alzheimer's can cause erectile dysfunction. Number 2, pelvic surgery. For example, surgery for prostate cancer. The nerves that control an erection lie very close to the prostate and can be injured during treatment. Number 3, medications. If you notice problems with erectile dysfunction after starting a new medication, that may be the culprit. According to a Harvard special report, an estimated 25% of all ED is due to the side effects of medications. The most common types of medications linked to ED include antidepressants, anti-ulcer drugs, and sedatives. And the most common type of medication is blood pressure medications, including diuretics and beta blockers. Number 4, vascular disease. Erectile dysfunction often happens before coronary artery disease in almost 70% of cases. Reduce your ED by improving your heart health. Exercise, stop smoking, decrease your alcohol intake, lose weight, and eat healthy. But I'll go more into this in number 5. Number 5, diabetes. This is the second most common cause of erectile dysfunction. Half the men with diabetes will experience erectile dysfunction within 10 years of diagnosis. High blood pressures can damage the nerves that control sexual stimulation. They can also damage blood vessels that provide blood flow to the penis for an erection. However, it's not just high sugars that is the issue. It's also your insulin. Men with insulin resistance, irrespective of their blood sugars, can also have erectile dysfunction. So even before your blood sugars are elevated and you are diagnosed with diabetes, this state of insulin resistance can independently cause erectile dysfunction. In fact, ED can be the first warning sign of insulin resistance. The scary thing is that most people are unaware that they have insulin resistance. The CDC stated that 96 million American adults have prediabetes, 1 in 3rd, but more than 80% don't know that they have it. Insulin resistance predates prediabetes and diabetes by 10 to 15 years. The other scary thing is that insulin resistance is not only the precursor to diabetes, but is the root cause of all the other issues I mentioned in my list. Insulin resistance is the root cause of cardiovascular disease, neurological disease, cancer like prostate cancer. And if you are taking a medication for hypertension, mental health issues, or gastrointestinal issues, I bet you didn't know that insulin resistance was associated with all these issues too. So if you address insulin resistance, you can address all 5 of the causes listed here. I have more videos on my page with lifestyle, dietary, and nutritional products to address insulin resistance.